One of the partners on this project is Dr. Sabra Slaughter from the Medical University of South Carolina. He looks for ways to close the gap between the sick and the health care they need. Now, Dr. Slaughter, I need to ask you, how do community education programs in the public health area make a difference?
Thank you, Dr. Ragstor. At the Medical University of South Carolina, we have found that public health issues or challenges are best handled through prevention and early identification. Ideally, you would want to, as others have said, to identify the source of a particular health hazard and prevent its occurrence. Secondly, if you aren't able to do that, you'd certainly want to be able to treat the condition as soon as possible. The treatment, the management, and the follow-through of medications are very, very critical to impeding the kind of health issues that we have heard identified during our program tonight. In addition to that, we have found that it's critical for an institution like the Medical University to partner with other institutions in the community, partnering with other health agencies, hospitals, governmental agencies, private industry, certainly with civic organizations, and individuals like those of us who are seated here and are part of this program tonight, getting folk involved and engaged in prevention, early identification, and the control of various public health issues. We are also very aware that if we are training the future health professionals for our state and for other parts of our country, that we must impart the same information to our students as they're moving through school, so that we are talking about interdisciplinary teams, so that we aren't thinking of a particular condition as something that the physicians treat, but the physicians along with nurses, along with pharmacists, along with dental practitioners and allied health professionals. We want to work all together to figure out ways of preventing the kinds of disparities that we have and the sort of issues that we're talking about with dengue and ciguatera.
Thank you. It's going to be a new world in the medical profession. Another partner in the project is Dr. David Rivers. He is also from the Medical University of South Carolina, and for 25 years he has visited some of the poorest areas in America that lack enough doctors and hospitals and have few medical services available. He promotes activities that build healthy communities in his work. Now, Dr. Rivers, I want to ask you the same question because I know your experience is very extensive in this area.
Thank you, Dr. Ragstor. Obviously, I agree with my colleague, Dr. Slaughter. I think we've learned over time that one of the best things you can do in designing programs for intervention and prevention is to engage the community on the onset. Too many times we come into a community and we begin to tell them what to do rather than asking them what the issues are and to listen to what the concerns are. After you listen, obviously, you can then design the best program, and also by doing that, you can get support and buy-in, because at the final analysis, the community members will be able to take action and a personal responsibility in going forward for programming. So that's what we're trying to do as we go forward. In addition, we know for a fact that a lot of the community require technical support, technical assistance. So we come in again, after we provide all the information, we come in and talk about contract and grants. Where do you find the resources? How do you get the resources? Because in the final analysis, we know for a fact it's going to cost some dollars to do the intervention. So that's our approach. We listen, we take action, and we build trust in the community. Too many times people come in simply to do a research project, to get a letter of support and go away, and do a white paper and put it in a journal without any kind of community support or action being taken.
Thank you. I love the passion.